Hi, my name is Jasmine. I'm a JCC nursing student, and this video is going to be an introduction into nutrition in regards to breastfeeding. I'm going to make separate videos regarding each section more clearly. So let's get started. So breastfeeding. Breastfeeding is usually done within the first year of life. Uh, However, usually the first 6 months is really critical because you do not want your baby to develop some type of allergy. We learned that with another teacher's PowerPoint. I'm not going to say her name, but you recommend the first 6 months of breastfeeding. Um, now the and we also do as nurses when they're in the hospital, we want to promote baby friendly breastfeeding stuff and materials. No pacifiers, lots of different types of nipples. That's why a lactation consultant is so important. An area where the mom can breastfeed. Just make her feel comfortable. The more she knows, the better she'll feel about herself. She'll feel like she's in control and she'll feel like she knows what she's doing. Uh, some of the advantages to breastfeeding for the baby. One of them is when a baby breastfeeds, it decreases risk of respiratory infection. Another one is ear infections, GI problems, and decreases the risk of diabetes. It also decreases the risk of cancer. And I think that is it. So breastfeeding is really, really important for a baby. Uh, it's just better for the baby. Some of the advantages in regards to the mom are so when a mom breastfeeds, it decreases her risk of cancer. It also decreases the risk of hypertension and increases the mom's risk of stroke too. So, writing down the maternal benefits of breastfeeding are decreased hypertension, decreased risk of stroke, decreased risk of, there's another one, I just said it, hypertension, stroke, and cancer, breast cancer. So those are the three main benefits of a mom who breastfeeds. Some of the another, continue to talk about advantages. So other advantages of a mom who breastfeeds, um, first of all, cost. It is expensive to bottle feed because you have to buy bottles, you have to buy nipples, you have to compare and contrast different things. But with breasts, you just gotta make sure you have a good latch, know what you're doing, the milk flows out. Another advantage of is environmental. We don't have with women who breastfeed, they don't have to they don't contribute to the landfills. Okay. So that's another advantage. Another advantage is that it's really convenient. You don't necessarily have to prepare. Um, and or due to the release of hormones, when we get in later after I talk about this, you'll know. And your breasts are sort of regulated. So when it's time to breastfeed, you'll experience this letdown and tingling. So conveniency is a really good one. Excuse me if I spell wrong. I'm a horrible speller. Another advantage of breastfeeding is immunological. All the benefits to the baby. And I just mentioned like diabetes, respirations, GI problems, ear infections. It helps the baby. Another one would be is they're very nutritious. So with breast milk, all breast milk is different in regards to the baby. Every baby is different, so all the breast milk has to be different. In addition to that, every stage of when the baby comes out, the body already knows what the baby needs in regards of nutrition. So a preterm baby is not going to have the same nutritional requirements as a baby who is born full term or post term. And the breast milk changes and adapts to the baby, which is very important. That's why breast milk is they recommend breast milk just for that purpose. Because with bottle feeding, in regards to formulas, formula never changes. Another benefit of breast milk with regards to nutrition is that when you breastfeed your baby, and you eat, the baby gets that nutrition too. I know I mentioned in another video that breastfeeding women still have to take iron and prenatal vitamins, but let's say I think in lecture she gave the example of broccoli. Mom eats broccoli, baby eats broccoli. Now, in regards to if the baby feels gassy or not, the mom may need to change her diet. But the more she eats, the more foods that she can promote to the baby once the baby starts getting on solid. So that's a really good thing because they have more taste buds open and they're more open to different types of foods. Another benefit to breastfeeding is psychological in regards to bonding. It's good when you breastfeed. When you aid a mom in breastfeeding and you see that bond and attachment, that skin to skin with that kangaroo care is not only good for the mom, but it promotes bonding and attachment, which was in another video I talked about in regards to Reuben maternal touching and stuff like that. So it's really good psychologically for the mom to uh, bond and attach to the baby. And I think that's it. So the disadvantages of breastfeeding. So these are great advantages, but there's disadvantages to breastfeeding too. Is work. The first thing that most women are worried about is when they breastfeed, are they going to leak? So work requirements or going back to work uh, um, is considered a disadvantage. The working mom. So the working mom has to buy a breast pump. She has to find an area to go try to breastfeed. Um, it's just tough. Um, Another disadvantage of breastfeeding is not just for the mom; it's for the dad or the grandma or the grandpa who wants to breastfeed and bond with it, and who wants to feed the baby and bond with the child, but they can't. So the father adaptation to bond with the baby, he may feel left out. Um, because he doesn't know what to do. But I know in a lecture with Jenny or Amanda, I forgot, they were talking about while the mom's breastfeeding, if the dad feels left out, he can go prepare the bottle so he feels a sense of accomplishment, like he's doing something to help aid in this bonding process and attachment with this baby. Um, Another disadvantage I want to talk about is food restriction. So the mom, you can drink alcohol and you can't smoke when you breastfeed. However, you cannot do that first and then breastfeed. um so you're going to have to restrict your alcohol intake. if she said anything. Um, yes, because if you were to drink and then you have to breastfeed the baby, the alcohol is going to come directly into the baby. Also, additionally, with smoking. Another disadvantage are certain types of medications you can't take. One being Sudafed. Now, I know in Su goodness gracious, can't spell. Oh, what's that spelling right? Sudafed. Sudafed dries breast milk up like the Sierra Desert. So please do not take Sudafed if you're planning on breastfeeding. Um, Another drug, let's say a medical condition, right? Which medical condition? Let's say the mom got diagnosed with postpartum psychosis or depression, right? The main drug they give in relation to psychosis, because psychosis is in relation to bipolar disorder, is lithium. Okay, lithium is an L5 medication, and if you are on lithium, you cannot breastfeed at all. Period. Ever. Um, you would have to either talk to your doctor about different types of things that you can do, but you definitely cannot breastfeed if you're on lithium. And another disadvantage to breastfeeding is just nipple discomfort, nipple pain. Uh, it's just hard. Maybe the mom doesn't moisturize as enough. She's not using her Lancin, her cream or her what's it called? It's like it's cream. These two creams, Lancin oil and I forgot. But there's cream. She's not using her creams to help aid in her breast discomfort. So that's a disadvantage. Most women who breastfeed, they can experience mastitis, which I'm going to go over another video, and that can deter a woman from breastfeeding. Or if your breasts are engorged, too, it's just hard to breastfeed. It's very painful. Engorgement for breast for women is when your breasts are so big. Sometimes when they're engorged, they're flat, and then you have to they'll send you home with these little nipple things, these nipple stimulators to try to get your nipples out. But once your breasts are engorged like that, it's very hard to manipulate your nipple to breastfeed, and it's very painful. Um, did I miss anything in regards to this? I don't think so. All right. So contraindications for why would you when can you not breastfeed? All these are conditions or diseases that can potentially threaten the life of the baby. So the first one is HIV. In this country, you cannot breastfeed if you're HIV positive. Hopefully, if you do get diagnosed with HIV, you are taking your art therapy, which I'll go over in another video. But in this country, you cannot. Um, Another reason why you cannot breastfeed would be if you're having to go through chemotherapy. Chemo drugs are very, they don't seek and kill. They literally destroy everything in their path. And if a mom is breastfeeding, the chemo drug is in her bloodstream. It will get into the baby's bloodstream and make the baby really sick. Another condition is in which a mom cannot breastfeed is if she has active tuberculosis, which is a um, respiratory condition that is spread through tuberculosis. It's airborne. Okay. And it can, if the baby were to breastfeed, it can cause harm to the baby too. Another another real simple one of why a woman will not be able to breastfeed is due to infant galactosoma. And galactosoma, did I say that right? Yes. Galactosoma is a condition in which the baby is allergic to breast milk. So if you have an allergy to milk, definitely not going to breastfeed. And the ways that they're going to know that is the baby's probably going to have some type of reaction or allergy or anaphylactic reaction after each feeding. And that is a medical emergency. Another reason why a woman cannot breastfeed is if she is on drugs. Um, Drugs like cocaine, crack, heroin, it goes into the bloodstream. And if a baby is born, if a mom is on drugs and she breastfeeds, the baby will get that into their system. Um, the same way with alcohol, but alcohol can leave your system within a few hours if you don't drink as much. We recommend for pregnant women to drink 1 ounce for 1 hour. Do not drink alcohol. Do not drink over an ounce for an hour because it has to get processed through your liver and your kidneys, and you don't want your baby to be harmed because of lack of education or you probably don't care, which hopefully the pregnant moms do care during that bonding process because we're documenting, making sure they do care before they leave. Um, Now, there's conditions in which a mom can breastfeed. Um, these are just the ones where she can't. HIV, TB, chemo, allergies, drug use. Okay. Now, there are the conditions in which she can breastfeed are one of them being herpes. I know we're thinking herpes in the bloodstream too, but she cannot have a it doesn't matter if the herpes is not spread through breast milk. Herpes, if she as long as she does not have an active lesion on her breast, she can breastfeed. Another condition in which a mom can breastfeed is if she has PKU. A lot of people don't know this, but Coca-Cola has PKU in it. However, there's not enough to be spread through breast milk. So if you go and you're like, oh my gosh, I can't breastfeed my baby, I just drank like 3, 4 Cokes. Uh, don't be worried about the PKU. Be worried about the caffeine and why your baby's not sleeping. Um, so PKU is another condition of which you can breastfeed. You can also breastfeed, like I said, with alcohol. Alcohol. If you drink alcohol or if you smoke. And the last condition that you can breastfeed with that people may think is a little weird is hepatitis. Hep- there we go. I think that's not right. Who knows? But you know what I'm saying. Hepatitis A, B, and C. All of them you can breastfeed. However, make sure education. She needs to wash her hands before she breastfeeds. Why does she need to wash her hands before she breastfeeds? Let's think about this for a minute. She needs to wash her hands before she breastfeeds because hepatitis A and B and C, but C is mostly spread through IVs, IV drug use. But she wash her hands before she breastfeeds after she goes to the bathroom because one, sanitation, and number two, when you are dislatching the baby, you literally have to put your finger on your breast, and if you didn't wash your hands, and you may have that hepatitis infested fecal matter on your finger, uh, it can go to the baby, and boom, baby has hepatitis. So you want to make sure you educate her, you look at her history, and she's like, I have hepatitis A, can I breastfeed? Yeah, you can, but every time you breastfeed, I need to stress the importance that you wash your hands, because we don't want the baby to get sick either. Um, Next page, what are we talking about? Okay, so what releases breast milk. The hormones responsible. Okay, so the two main hormones responsible for the release of breast milk are prolactin and oxytocin. You already know a little bit about oxytocin. Oxytocin helps the uterus contract. That's why breastfeeding is great. Uh, Oxytocin, in particular, is released from your posterior pituitary. Prolactin is released from your anterior pituitary. Um, with these two, especially with this one, when you're breastfeeding, you're gonna know when you have to breastfeed because, like I said, the baby is adapted to the mom. So it's like this little letdown, and if she says, "Oh, my boobs feel a little tingly," maybe your baby's hungry. So when you go assess the baby, and the baby is making smacking sounds with his mouth or her mouth, and they're like going, like their lips are going off to the side, um, and they still have that rooting in reflex, which they should. Honestly, newborns should have rooting reflexes still. Um, it's time to breastfeed. You women usually breastfeed um every 2 to 3 hours. We'll go into that a little bit later, but yes. Now the breasts are made in a supply and demand manner. Um, and like I said, they change during the whole they change during the whole developmental stage of the baby. Now, breast milk is um, made throughout the whole pregnancy. However, you have two other hormones that counteract these two hormones so you don't leak throughout your whole pregnancy. And the hormones that stop these two from telling your body when it's not ready to produce milk are estrogen and the cousin progesterone. These two, although your breasts are making milk throughout your whole pregnancy, estrogen and progesterone will tell oxytocin and prolactin, hey, back off. We're not ready yet. Um, but another thing that's really interesting about this uh is that if a mom is not breastfeeding after she gave birth, or she was and now she's not, and she's not producing enough milk, we need to look at whether or not she may have a placental fragment inside of her uterus still. And the reason why we're going to look for that is because the only way um, a mom can breastfeed after the birth of a child is if everything is expelled from the uterus. Um, if she has a placental fragment still stuck up in there, she's not going to be able to breastfeed. So we're going to tell her to come back in so we can assess. And there are other symptoms to a retained placenta fragment. One of them would be bleeding. Or let's say her she was only rubra is only for the first 1 to 3 days, and she's only bleeding, but and then she stops. She has no serosa, she has no alba after her when she's supposed to, and she's breastfeeding, and then her breastfeeding sort of just slows down or stops. So that's another indication where we when we do our assessment, we're gonna tell the doctor like she was breastfeeding and she says it's getting lower and lower and lower. So hopefully we catch that before she leaves out the hospital, but um, you never know. Everyone is situational. Um, and I think that is it in regards to introduction to breastfeeding. Bye.